Health Minister Dr. Phaahla has officially launched the digital COVID-19 vaccine certificate. He says this will provide proof for individuals who have been vaccinated and will be used to facilitate travel and access to establishments and gatherings. The minister held a media briefing yesterday morning, updating the nation on the government's interventions against the virus. Now, for an update on the developments around the digital COVID-19 vaccines, I'm joined by Dr. Nicholas Crisp, the Acting Director General in the Department of Health. Dr. Crisp, a pleasure to have you on the program this afternoon. Now, the UK will accept South Africa's COVID-19 vaccination certificate for access into the country. What does this mean for South Africa, especially for travellers and the tourism sector in general?
Good afternoon, Atlanta, and good afternoon to the viewers. Yeah, it's a very exciting development. For all round, it's been an exciting week and lots of action. What the certificate means, first of all, is that we can use it for proving vaccination status in South Africa so that we can start to open up. And we know that the Sports Ministry has been talking about a return to play, so that's going to be able to facilitate that, and you'll hear more action from them in the next couple of days. But what it means also for international travelers is for South Africans who go abroad, this certificate will be accepted by at least now the UK and hopefully other countries shortly. We do swap certificate information between countries and accept one another's certificates, and it's been a little bit of a difficult thing for us until now. So it just means that once that certificate is accepted as proof of vaccination, it's easier to move between countries.
Now, as you've mentioned, the Health Minister, Phaahla, officially launched this digital vaccination certificate. And he says with the launch of the vaccination certificate, South Africans can expect more sports and recreational activities, entertainment and music festivals to open up for those who are fully vaccinated. Now, there is also a drive to keep focus to control this pandemic, also increase vaccination and strengthen the genomic surveillance in Africa. Just talk us through the significance of this.
Okay, so what one wants to do is you want to make sure that people who move together in crowds or are near to one another, besides the maintaining of an adequate social distance and wearing of masks and washing hands and ventilation, as we know, if all of those people are vaccinated and or have a recently negative test, there's a reduced risk of transmission in that group. So workplaces, sports centers, stadia, concert halls and so forth may choose to have events where they can increase the numbers over time if they allow only vaccinated people into that environment. The same might apply to a restaurant or to any other place where a proprietor might decide that they're going to reduce their risk by making sure that all their personnel and all the people who come into their establishment are vaccinated.
Right.
Now, if you're going to make those kinds of policies, you need to be reasonably confident that the people that you are allowing in are vaccinated. And this is a tool that enables people to do that. In terms of the sequencing of the actual RNA virus, we have a lot of laboratories who work in tandem, and there's a consortium of some of the high-end laboratories that are looking at the genomic sequencing, and they report on that not only in South Africa but on a global template. We in South Africa work together with our neighboring countries, and our labs work with theirs. There's training taking place between the laboratories and support that's taking place, so that we all know which virus is in circulation. And for the public, what we're talking about is it the Delta variant? Do we still have the Beta variant, the Alpha, which was the original one, or are the other variants in circulation? And that matters because those different variants have different kinds of transmission, and we are able to predict how to manage our crowds and our traffic and our behavior depending on the virus that's in circulation. I know it's a bit complicated, but that is what we're trying to achieve.
So despite some of the teething problems since the launch of the digital vaccine certificate, there is also this general view that the system is an important step in standardizing proof of vaccination. What has been your observation in this regard?
Yeah, absolutely. It's been very well received. It was a busy day yesterday. Obviously, when one opens up, a lot of people try to get on the system. And because we've been testing various components of the system in the week, people had picked up that it was open and closed as the team was testing. So they thought it was open and they were frustrated by not being able to access certificates. But now that it's open, the system is stable at the moment. It's sending out about 100,000 SMS reminders per hour at the moment. So it's just been maintained at that level. They've sent out 1.16 million SMS reminders today. And that takes us up to about the people who were vaccinated on the 2nd of July. Their messages have gone out by 4 o'clock this afternoon. We have had just over 435,000 certificates downloaded by 11 o'clock this morning. And the queries on the help desk obviously start to pick up as well. So the general queries have gone up from about 770 last Friday to 4,700 this Friday. It's about a 5-fold increase. And the information edits, which is where people are requesting changes of cell phone numbers or information like that, has gone up about 4.5 times, from about 800 last Friday into the thousands yesterday.
So the health minister also gave a word of caution to South Africans, saying that South Africa is not out of the woods yet and people should continue to maintain vigilance. Just talk us through your thoughts on the importance of accelerating the vaccination program in the country.
Yeah, I mean, we try and hammer this from the health department over and over again every time we get an opportunity. The way to protect yourself over and above wearing a mask and washing your hands and doing the things we've been talking about from the beginning is to vaccinate. There's very, very clear evidence that vaccination protects people from illness. It doesn't 100% stop the virus from transmitting, and therefore you can still get ill. But we do know that a fully vaccinated person with either 1 dose of Johnson & Johnson or 2 doses of Pfizer is at a significantly reduced chance of being critically ill or ending up in ICU or dying. And we have seen, and last night I was talking on another program where I was saying, we know that less than 20 or around 20% of people in hospitals have been vaccinated. Some of them have only had 1 of their 2 doses. And the people who are in intensive care units, it's even less than that. We have a lot of hospitals that are reporting their ICUs have only unvaccinated people. They don't see vaccinated people in the intensive care units anymore. And that's what we want. We know that the people at greatest risk are those over the age of 50, and it gets more and more risk as you get older beyond 50. And that's the group of people we really, really want to beg to please come for vaccination, to protect yourself, protect your family, and to make sure that you don't end up in intensive care unit and dying. But for everybody else, it will reduce your chance of transmitting the disease, and it will reduce your chance of really getting sick and ending up in hospital.
Now, also associated with the rollout of these vaccines is the misinformation that comes where people are often given the wrong advice or told not to get their jab because of the kind of side effects that come with taking these vaccines. What message would you like to drive in this regard?
Yeah, well, let's be very clear. The side effects are not uncommon, but they are very mild. You get body pains, you can get a bit of a headache, you can feel lethargic. That is not uncommon. And it hardly ever lasts beyond 24 hours. It'll be very uncommon when it goes beyond that. But severe complications, what we call adverse events following immunization, are extremely, extremely rare. If you think we vaccinated 18 million doses of vaccine in this country, more than that now, and we have had a handful, less than 5,000 reported serious adverse events, and many of those adverse events that have been reported cannot be causally linked back to the vaccine itself. So it's a handful of very rare potential impacts from the vaccine, and the risk is just incomparable. Your chances of getting really sick, ending up in hospital and dying if you're not vaccinated is thousands of times more than if you are vaccinated. We also want to caution that there are messages doing the rounds telling pregnant women not to be vaccinated. That is not true. We want pregnant women to come for vaccination. It will protect them and their baby from being exposed to the virus and getting ill. We also want people who are immunocompromised to come for doses of vaccination. So there's no risk at the moment for people. It's very, very rare that a clinician might have a reason to advise a person not to be vaccinated.
That's the acting DG in the Department of Health, Nicholas Crisp, speaking to us there about the launch of the digital vaccination certificate. Also, very importantly, encouraging people to go out in their numbers and get their jab.